Hello everyone. Today I will talk about cleft lip and palate and their effect on the eruption of teeth. You might be thinking that this isn't really important for us to know, but in fact, cleft lip and palate are the most common craniofacial anomalies, and every 1 in 700 infants are born with it worldwide. So, what is cleft lip? Well, it's a separation of two sides of the lip, and in many cases, this separation will include the bone and gum of the upper jaw. It can be complete, in which the separation extends from the lip all the way into the nose, or incomplete, in which the nose is spared. Cleft palate, on the other hand, occurs when sides of the palate fail to fuse as a fetus is developing, which results in the opening of the roof of the mouth, essentially meaning that the baby has an oral antral communication. Cleft palate can be incomplete, in which it starts at the back of the palate from the uvula and extends forward. It may or may not reach the incisive foramen. Or it may be complete, and it reaches all the way to the alveolar ridge, and it can be unilateral or bilateral. The fetus's lips forms between weeks 4 and 7 of the pregnancy, while the palate forms between weeks 6 and 9. Any problem in these periods leads to a cleft lip, or a cleft palate, or both. Surgeons tend to intervene and correct cleft lip when the baby is 3 to 6 months old, while cleft palate is corrected when the baby is 9 to 12 months old. So, why does this anomaly affect the teeth if it's corrected this early on? Actually, there are multiple reasons for this, including local factors such as scar tissue formation after surgical repair, delayed formation of the crown or root, poor blood circulation after surgery, lack of space in the maxilla, or lack of bone support. As a result, the teeth may be missing, mishapped, or irregularly aligned in the arch. The teeth most commonly affected are those that lie in the line of the cleft and are at the same side of it. The tooth most commonly affected by this anomaly is the maxillary lateral incisor, in which its eruption may be delayed from 8 to 17.5 months later than the normal eruption time. The delay depends on the location of the cleft in relation to the maxilla. In some cases, the lateral incisor may be entirely absent, while in other cases, the lateral incisor may be duplicated on both sides of the cleft, and still in other cases it may be formed with an abnormal shape or size. The teeth in the area of the cleft may be displaced, so they result in abnormal positions. Occasionally, the central incisor on the cleft side may have the same problem as the lateral incisor. In primary dentition, more teeth are congenitally missing in the upper jaw than the lower, contrary to the permanent dentition in which both upper and lower jaws are affected. Moving on, the following factors cause more significant delay in the eruption of teeth, like hypodontia, in which the prevalence of this condition increases strongly with the severity of the cleft, and bilateral cleft, which causes the greatest delay. Now, we've talked about the effect that cleft lip and palate have on the eruption of teeth, but what about the eruption pattern? Cleft repair may influence the eruption pattern of the maxillary centrals approximating the cleft areas. They become more retroclined and retropositioned with the nasomaxillary complex. The size of the erupted permanent teeth may be smaller or have metric symmetry in the crown to root ratio. This is apparent in both jaws. Now that we know the possible effects that the cleft may have on teeth, how do we treat it? This deformity is highly treatable, but it requires a team of specialists to fully treat the condition and get the best results. Once treated, the prognosis of the patient would be excellent. Most dentists recommend that the first dental visit should be around 1 year of age, or even earlier if special dental problems are present. Early dental care is important, and it involves appropriate cleaning with small, soft bristled brushes as soon as the teeth erupt. It also involves implementing preventative care like fluoride treatment and taking panoramic x-rays to determine the best course of treatment for the child. The treatment of the patient after repairing the cleft involves more than one specialty, including orthodontic care, coordinated dental surgical care, and prosthodontic care. Orthodontic care has many important aspects, including having the first evaluation take place before the child has any teeth, since facial growth is an important aspect of orthodontic care. Usually the child undergoes 2 or 3 phases of treatment, each one with a specific goal. The orthodontist should monitor the child while he is growing and intervene with the treatment when necessary and appropriate. The final phase of treatment begins when all the permanent teeth have erupted. In regards to coordinated dental surgical care, the coordination between the orthodontist and the surgeon is important in the management of a bony defect in the upper jaw that may result from the cleft. Reconstruction of that bony defect may be accomplished with a bone graft from the surgeon, while the orthodontist may place an appliance to prepare the jaw for the bone graft. A retainer is placed after the bone graft until fixed braces are applied. When the child approaches adolescence and the teeth don't meet properly because of abnormal jaw growth, then the orthodontist and surgeon join forces to reposition the jaw after pubertal growth is completed. This is done by performing orthognathic surgery. What about prosthodontic surgical treatment? How does it help? Well, this treatment is done to replace missing teeth and other oral structures with prosthesis or orofacial appliances. Implants, crowns, and bridges are used to replace missing teeth, while palatal lifts and/or speech bulbs are used to seal off the palate from the mouth and improve speech. All in all, good dental care is essential so that the teeth holding the appliances are healthy. That concludes our lesson for today. I really hope you guys found this video enjoyable and informative. Please don't forget to give us a thumbs up, share, and subscribe to our channel on YouTube. Thank you for watching. Have a nice day.